working together for clinical excellence. Hospital teams in South Tyneside and Sunderland are working together to plan for the future. Our ambition for clinical excellence is simple. We want to build outstanding services which offer the highest quality of safe patient care all of the time, every time, for each and every person who needs to go to hospital. To do this, Phase 2 of Path to Excellence is looking at the following areas of hospital care. Emergency care and acute medicine. This is the care provided when patients arrive at our emergency departments, need emergency admission, or have an urgent healthcare need. Emergency surgery and planned operations. This is the care provided for patients who are admitted as an emergency and then require urgent surgery, or who have been referred by their GP for a planned operation. Planned care and outpatients. This is the care provided in hospital after patients have been referred by their GP for a test, scan, treatment, or operation. We're also thinking about how we can improve important support services such as physiotherapy, pharmacy, and access to tests and scans. Changing hospital care alone will not solve pressures facing the NHS. We're also thinking about how to look after people better in their local communities and how we can support people to live healthy lives. These are our 3 pillars of transformation. Our working ideas so far for the future of local hospital services range from minimal change to much greater change, and we now want your views on our early thinking. But first, let's quash some rumours. There is absolutely no intention whatsoever for either hospital to close. Both South Tyneside and Sunderland hospitals will continue to exist. Both hospitals are equally important to us and our local communities. But we do need to change the way we deliver some services to achieve our ambition of outstanding clinical excellence for our patients. In all of our working ideas, there would be continued 24/7 local access to urgent or emergency care, and we've been thinking about how we could arrange surgical services in the future. We also want to build a new state-of-the-art integrated diagnostic and imaging centre at South Tyneside District Hospital, serving both local populations to help manage ever-rising demand for diagnostic tests and scans. We have already delivered hundreds more outpatient appointments locally in South Tyneside and are exploring more opportunities to bring care closer to home where we can. There are many important factors to consider as we continue to develop our working ideas. We know that investment will be needed to make our ambitions a reality, and we're currently exploring all options for funding. This will be an essential factor to decide which working ideas can be developed as scenarios to take forward for full public consultation. We also need to consider what impact there could be on the ambulance service, who are fully involved in our discussions, as well as the travel and transport implications for friends and family visiting loved ones in hospital. What happens next? This is the opportunity for people to look at our working ideas so far and feedback views to help us develop the future scenarios for formal public consultation, which is expected later in 2019. Please do get involved and tell us what is most important to you.